My name is Mohammed Abd-El-Barr. I specialize in minimally invasive spine surgery. I think that minimally invasive spine surgery is really important for patients because it allows them to have surgery with decreased blood loss. The time in the hospital is less, the recovery time is faster. But one of the drawbacks of minimally invasive spine surgery is the amount of radiation that I expose the patient to, I expose myself to, and I expose the staff to. And we know that radiation is not benign. So we know that orthopedic surgeons have a higher risk for cancer due to radiation. So any way that we can do to decrease the radiation is really important for myself, for my OR staff, and for the patient. Trackx is really integrated into the OR very nicely. So the fact that there isn't a lot of setup time, this is something that's very easily learned. It's not very difficult. I do a lot of very minimally invasive surgery where I do a T-lift in a completely percutaneous way. And so for me to do that before Trackx would mean that I would set up 2 C-arms. It would take sometimes an hour to half an hour just setting up. So those are when the patient's asleep. So that's adding OR time. And now I have a way to go in just with 1 C-arm, no setup time, able to get started right away. So I decrease the amount of time that the patient is under anesthesia, and it decreases the clutter in the OR room, and it decreases the risk for infection and other things. The OR is a very dynamic area. There's a lot of moving parts and so on. So you don't want a thing that is so rigid that if somebody touches it, then you have to start all over. So because the reference arrays are on the C-arm, they're out of the way. The fact that you can recalibrate your system just by taking another X-ray is really important as well, because I don't have to do another C-arm spin or anything like that. I don't have to have a pre-operative CT or intraoperative CT to do this navigation is also very important. A lot of times when you're in surgery, you're trying to find, especially for minimally invasive surgery, you're trying to find the ideal starting point for your screws and so on. A lot of times you're taking X-rays. Now I'm able to track my instrument in real time without taking X-rays until I find a very good spot, and then I usually take 1 X-ray just to confirm. We found that the amount of X-rays we take is decreased by about 70%. We also found that the amount of time it takes to find that ideal spot has also decreased by about 70%. So if we're decreasing radiation and we're decreasing OR time, those are all benefits to the patient and to the OR staff. The impact that Trackx has made on my practice has been very tremendous, both from the patient's standpoint, so I'm able to do surgery in a more efficient manner, in a faster manner, and I think in a safer manner. But also because I'm in actually a teaching environment. Before, I couldn't see what the residents were doing. Now I can actually see on the screen in 2 dimensions where they are, where they're putting their instruments and so on. And that's been a great boost to me so that I'm able to teach them, okay, you want to target this area here without taking a lot of X-rays as well. So I think the fact that I'm able to do safer, more efficient surgeries, also been able to teach people these techniques has also been a great benefit to myself and to the patients.